Today's session will be hosted by Caroline Constantine, the MD of Right Directions, myself and Ian Warren, Head of Health and Safety. And please ask questions and please share any advice that you have. We will also be compiling all the questions and answers from the clinic so that you can refer back to them at a later date. So as I've already said, the aim of today is to stimulate thought and discussion of how and when the government announcements follow that we may be able to get back to the new norm. We think the key factors are to provide staff with confidence and knowledge on how to be safe, ensure consumer confidence and engage with other stakeholders, so clients, landlords, to be able to maintain this suitable business model going forward. What we've tried to do here is, using our operational experience, including our health and safety knowledge, we have developed the draft reopening and mobilisation check sheets that may help you and your organisations manage and to ask yourselves the right question and implement appropriate action. We've been reading the guidance which is being published by lots of industry specialists, and you've got some fantastic tools to be able to refer to. What we're trying to do for you is try to pull that together, because leisure isn't just about the gyms and the pools. This is about all of the activity areas and how you're going to start to look at your remobilisation and move forward into this new normal. I'm going to pass you over to Caroline. We are socially distancing. I am going to move away from the screen now, and Caroline will come in. Please enjoy the session from today.
Good morning, everybody. Hope you're well. This has got to be the weirdest Friday bank holiday on record. I hope you're all okay. We were listening to some people who were unmuted earlier on who are juggling kids and dogs and all sorts. So thank you ever so much for joining us this morning. Having been operators for many, many years, and I regularly take myself back to being a centre manager, I do wonder how I would be coping now. So hopefully we can give everybody some sensible, practical advice over the coming months to make sure that our customers come back in feeling confident with what we're doing. I was chatting to one of our team the other day, he lives in Nottingham, and he was saying that they have a network of locals, and lots of people on that network had said, don't go to Asda. They're not social distancing, they're not putting any measures in place. Whatever you do, don't go to Asda. So I think it's mega important that whatever we do, the perception, hopefully the reality is that the customers can come in feeling confident. Something really struck me yesterday. I've got two very healthy 70-year-old parents, and neither of those want me or my family anywhere near them. Now, if they don't want to cuddle daughter and grandkids, then we've got a big issue, and we've got to make sure that every single customer feels safe coming back into our buildings, which is going to be a massive challenge. So we're here to help. Hopefully some of the ideas we're going to come up with are going to be practical, sensible suggestions on building that consumer confidence up, and hopefully getting some of the people who are in at highest risk of catching COVID and not recovering from it into our buildings with an intention of losing weight and changing their lifestyles. I was spitting feathers at the government last week when somebody said that obesity and an unhealthy lifestyle would lead to people feeling more likely to get COVID and suffer from it. And then Rab went on to tell everybody that we needed to do spectator sporting. So it's really important that we make sure that our industry is at the forefront of government thinking from now on, because this COVID virus isn't going to go away quickly. Right, the first things that we need to think about, business continuity plan. We're not going to go into detail on this, but all organisations must make sure that their business continuity plans are up to date, and if they did include pandemic, I'm sure it's probably not completely accurate. They need to go back and look at those again. We understand that survival and financial constraints are massively important here, so we are not going to be talking about how we deal with local authorities and our clients and our leaseholders and people, landlords, at this point. So continuity plan at the organisational level needs to be looked at. The next thing that we need to look at are the risk assessments for our company and our centres. And this is the bit that we're going to really focus on in the next 10 clinics with you, going through this in detail. We think that the UK active stuff that's come out is great, and there will be lots of other stuff coming out from IQL and RLSS. But we do understand that our leisure centres are bigger than what's in those, and we do have creches, and we have play schemes, and we have trampolining, and we have climbing walls, and we have trampoline parks. We have so many different facilities that at the moment aren't covered by the guidance. So we're going to have to use sensible, practical, common sense approach in getting our buildings open. So first thing we've got to concentrate on is the risk assessments for our customers, our staff, and for any vulnerable employees that we have. When we have written those risk assessments, we need to convert those into a response plan or a remobilisation open plan, whatever you want to call it, and the team that are going to do that. We've decided we're going to split this first webinar up into 5 sections. That's the whole building, including customer information and checks, staff instruction and information, cleaning and maintenance, virus prevention, and then how we source key information going forward. So that's the initial plan of how we're going to run today, and then going forward into the other clinics, we're going to go into more detail. So just talking about risk assessments to start off with. This risk assessment, we're currently writing a risk assessment that hopefully we'll be able to distribute to our clients, and anybody else that is interested can please contact us. We're going to be starting with social distancing, cleaning, disinfection, first aid, handling, post, how we get people to queue for fitness classes, all of those sort of things. We're going to be going into more detail as we go through. But obviously this is going to come out to you. You can then start thinking about this list, along with, hopefully all of you will have a copy of our suggested first draft checklist of ideas to start getting you thinking. Please look at that as well, and that will start you thinking about the questions that you need to ask for your building. We understand that every single building is going to be different and have different needs of how and where people can queue, where people can stand, what reception desks look like. There is going to be individual issues, changing rooms, village change. There's going to be issues for everybody, and we obviously need to take all of those into account to make sure that our customers feel confident. So risk assessment, obviously that's going to be the first port of call. Start walking your building, start thinking about how you're going to get people in and how they're going to feel safe. Once we've done that risk assessment, we're suggesting that then changes into a reopening checklist or a response plan. And that response plan will be what you're going to do, who's going to do it, when they're going to do it, and when you're going to check that it's working and amend it. This response plan we don't think is going to be written once. This is going to be something that you're going to be reviewing regularly based on stuff that comes in from the industry, stuff that comes in from us, stuff that comes in from other people you've talked to, and your staff and your customers with their comments. So that response plan is going to be a working action plan where we used to have service improvement plans. This is going to be similar to that, but based purely on making sure that we're up and running and we're running successfully with the customers feeling confident. Hopefully that's a good starting point. I'm going to hand you over to Ian, who's going to start talking to you about the 4 main areas that we think that you guys should look at. Hope that's been helpful. I'm going to hand you over to Ian. Ian, can you hear us?
Yes, I've unmuted. Can you hear me?
Brilliant. I'm going to unmute myself.
Right. Hi, everybody. Just as a starter, we are going to respect the 2-minute silence at 11 o'clock. So if we're still talking, we will at 11 o'clock just stop for 2 minutes. And we hope nobody minds the fact that we will use that as an opportunity just to remember the VE Day celebrations and the end of the Second World War. It seems odd to be talking about this when that war gave us so much freedom that we're currently talking about ways of coming out of a lockdown and trying to regain many of those freedoms. So where do we start? In many ways, we're very fortunate in that we aren't starting from a blank sheet of paper like the supermarkets and other permitted outlets when lockdown first occurred. As Caroline's already said, we will get government advice, hopefully. We'll also have other bodies like UK Active, Swim England, IQL, PewTag to provide us with additional guidance to support our own common sense approach to trying to find ways to reopen. You've also had, as Caroline said, your own experiences over the last 6 to 7 weeks. Just on what Caroline said, reflect on when you've been to a food store. Have you felt it's been well managed? Have you felt it uncomfortable with the numbers in the store? Staff and other customers not distancing, cleaning regimes for shopping trolleys, baskets, etc. Have you actually changed your habits as a result of that and maybe gone to a different store? Many of our customers will be making the same judgments on us, and it's absolutely essential that we get this right, because many of them might never return if we get it wrong. We must remember COVID outbreaks or incidents linked to our centres are reportable now under RIDDOR, and as such also risks the additional worry that if we get it wrong, we could be subject to external scrutiny. We have to get it right. This is here for the long term, and we have to establish a new normal very carefully. As Caroline said, we split the checklists into 4 sections. First off, and this first slide, is to look at the buildings. We'll then go on to staff, cleaning and maintenance, and then viral control. You've got to ask yourself the questions: are you going to open all of your building? Are you going to open all of your facilities? Differing groups need to be considered. I would add COVID-19 shielding and people over 70 with underlying health conditions into that list of people we need to consider. I rather foolishly suggested to my brother-in-law, who's a professor in medical ethics, that we could have time set aside exclusively for these people. One asymptomatic member of staff, i.e. someone who doesn't know they've got it, or customer, could infect the whole group. So that may not be the best suggestion in the world. So we have to think around how we provide opportunities to keep those groups active. And the longer they're in lockdown, the more inactive and the more the need will be. This may, however, give us opportunities to look at small groups, controlled sessions, outdoor exercise, etc., which will help us move forward. We need, as Caroline said, to look at the densities within our building. If you can't achieve social distancing in spas and saunas, then maybe these should not be reopened. On the other hand, sports like golf might easily be capable of being reopened. Certainly if I'm playing, I'll be nowhere near my other 3 players. I'll be in the rough or failing to get past the ladies' tee. So things like golf will probably be easy to reopen. Each facility, each centre will differ. Can we move on? Next slide. We then need to consider our staff. We must gain their confidence and ensure they understand the measures needed to protect themselves, colleagues and customers. They must understand and adhere to the control measures that you'll be putting in place. Consideration to pre-work screening, although this is not the answer. Someone who can be infectious without knowing it, and therefore simple checks such as taking their temperature before they start work isn't necessarily the end outcome that you want, but it is one of the control measures you might consider. Checks on qualifications. While the HSE have suggested a 3-month extension of most qualifications is acceptable, it's still essential that you check the competence of those staff before allowing them to perform any tasks, be that lifeguarding, pool water management, etc. Next slide, please. Cleaning and disinfection. Ensure you're using antiviral cleaning materials. I've been in shops and seen them using products similar to those that we use in our leisure centres. Many of these are antibacterial only. Detergent, soap and water and antiviral cleaning are what is needed. Chlorine, bleach are effective, but could bring other risks which need to be balanced against the need to control the spread of the virus. Air exchange in rooms without fresh air need to be considered. We shouldn't be carrying out vigorous exercise in rooms that only have air conditioning that recirculate the air within it. We need to look at our premises and understand what areas can be used and what can't. When we've got staff changing air handling filters and air AC filters, we need to think how they can do that safely and how they can dispose of the old product safely. Statutory inspections still need to be carried out. Clearly, if you haven't been able to get your lift inspected during your lockdown before you reopen, you may not be able to use your lifts until such time as they come back, as you're able to get them fully inspected. The HSE haven't given a waiver on that. Next slide. And finally, virus protection. The processes you all ultimately put in place will need to ensure we control the risk of viral spread and new outbreaks. We don't want spikes reoccurring, and the thing we've become accustomed to through the government briefings, that the R rate doesn't go back up in your area and resulting in local closures again and lockdowns, which will cause more disturbance than good. You will need to build in a review process and perhaps mystery visits to ensure that your staff are adhering to the processes that you've put in place. Staff aren't reverting to shaking hands, that they're keeping the distances, that they are undertaking the cleaning process that you wish. We need to seek feedback from staff and customers of how they feel. This will establish a new normal. I hope that our other stakeholders will recognise the value in the service and need to ensure that these changes that we make are organisationally sustainable, and that clients recognise existing contractual terms may no longer be possible, and that landlords recognise that they may have empty premises for many months or years unless they show forbearance on rents. It's really important we get this right if we're going to move the industry forward and regain the confidence of all our customers and clients. Thank you. I think we're doing well for time, so I don't think we'll be into having to stop.
Me again. That's a starting point for me and for everybody to start thinking about their journey back into the centres. It may be worthwhile you're sat at home if you're not homeschooling, which I could guess is a massive challenge for everybody, is to start in your heads walking your buildings, thinking about your activities, and start thinking about how we can social distance, and if we can't social distance, how we deal with that, and how we inform our customers of why we're not and what we're putting in place to make sure that their families and friends are protected. So where we're at next, we're planning on doing 10 more. They're going to be very specific, and we're going to be inviting people in to do help with those, including IQL, CIMSPA, and somebody else from England, and anybody else that we talk to who starts issuing guidance, we'll start asking them to come in and help us. We are behind the scenes starting to write a detailed risk assessment for leisure centres, hopefully thinking about everything from, even in UK Active have suggested that classes are 10 minutes apart. Where are those people going to queue, and do we need stickers on the floor outside the studio doors, and do we give every single member of come in before they come in some hand sanitizer? So we're going to be starting to think through absolutely everything, how we're going to manage our creches, play schemes, etc. So
Caroline,
sorry, Jill's just going to...
Can I just jump in here? We've had a question from the floor to when will the frontline awareness training be available for people?
Okay, frontline pandemic training. What we're planning on doing is hopefully doing is Teams training similar to this that people can sign into, which is about them looking after themselves, social distancing themselves, how they need to behave when they're at work, what they need to do if they think they've got symptoms or that their family have got symptoms, and how they react to people if they think those have got symptoms, and generally how they behave in the leisure centre. It's not going to be specifically for gymnastics coaches or trampoline coaches. It's going to be general for all frontline staff on how they walk the building, and we will not be seeing 3 recce's walking around the building with a bin bag and a litter picker-upper again for a long time. So that's going to be happening. We're hoping to get that written in the next couple of weeks and launched probably by the end of May. Again, we don't know when the government are going to open up, but we have heard through the grapevine that leisure is going to be fairly low on the list. So we've certainly probably got at least another month. We're not sure yet, obviously, and it's all speculation, but it is going to be at least another few weeks before we are reopening.
I have another question, Caroline, for Ian. Can you cover the aircon room section?
Ian, you need to unmute.
Sorry, Jill, I missed the end of what you said.
Can you cover the aircon room section in more detail, please?
Yeah, I think within your sites you will have some rooms where you have ample fresh air. You either have windows or you have air handling systems that do bring in a certain amount of fresh air. If, for instance, you've got a basement that only has air recycled within it, i.e. an air conditioning unit that chills it but doesn't bring in fresh air, then clearly you aren't going to be able to have vigorous exercise in there, because all people are going to do is cough out the vapour. There'll be air droplets that will be taken up into the air handling and probably kicked back out again into the room, and the risk is going to be a lot higher in rooms without lots of fresh air coming in and air exchange happening. China, for instance, we were listening to the Dave Stalker webinar yesterday, and China have banned any gyms reopening within basements for that very reason. So you'll need to think about each area within your building, how the air handling works, whether you've got adequate exchanges that will reduce the risks. Is that adequate?
I've got a fantastic idea. If you have outside space, get your steps, get your weights, get them outside. Let's try and project some, get a music system outside for the summer months, see how many classes we can do outside. I know for a fact I'd love to go back to my leisure centre and do some body pump on the grass. Not an issue for me. I'm sure somebody will tell me that there is a reason why that can't happen, but I'm pretty sure there's quite a lot of activities we can start doing outside. Any more questions? We've got another question, I think.
I have another question for you, Caroline. Are Right Directions draft risk assessments available for people to work from?
We're currently writing my next slide, actually, so thanks for that question up front. We are writing the risk assessment based on obviously our experience and pulling in from everybody on the team, and hopefully the clients that we work with their suggestions. We will be offering the opportunity to help sites, so either we can virtually walk a building with a manager and offer ideas and suggestions on how they can write their risk assessment they need to put in it, or we can come to site. The one that we're actually writing is available to all Right Directions clients on our Stitch platform. Will be on our Stitch platform for everybody to use. If you're interested in having a copy of that, please get hold of. Please, by all means, get hold of us on info, and we can talk to you about how that's available. So we are obviously keen to help the industry as much as we can, and hopefully our opening checklist that we've written already is a good starting point. When you've written your risk assessments, obviously that needs changing into a response plan, action plan. Again, we can help with that if you want us, and obviously we can answer questions if you need them. The other things that we are going to offer people is if somebody wants us to come in, they can write their risk assessments, do their response plans themselves. We can come in and have a look before the opening and say, absolutely bloody marvellous, you've done a good job, or you're really missing a trick. So just very briefly then, we're planning on helping people if they need us before they open their buildings. And equally after they've opened their buildings, if they want us to come in and have a walk round, check their processes, that they can then demonstrate to local authorities that they are ensuring that our customers are in the buildings with confidence. Very briefly then, just to finish, over to you guys. If you've got any more questions, please type away. Jill's going to shout out some more questions.